Okay, it is Monday, May 24th, 6:03 in the evening. I'd like to bring the Douglas Board of Health meeting to order. First on the agenda, we have COVID-19 clinic, but we're gonna hold off on that right now. Unless you want to,
I have been out of the loop.
it would be nice to
Yeah.
have her here, so,
Yeah, I kind of been out of the loop on it. I know they went to the schools,
right.
and we're doing the schools.
Dick, can you fill us in on that?
Been very busy up until this last week.
Yeah,
I went in there Tuesday, I guess it was, Tuesday morning, and it was dead.
really?
There was nobody in the waiting room, nobody. And I looked at the people I've been working with previously, because I wasn't working that day,
Hmm,
and they said it's been like this all day.
really? So no snacks?
Well, the snacks could have been there, a billion snacks, but no
Yeah.
people getting them.
Yeah. Huh. I guess it was all of, the big rush at the beginning.
Well, it was kind of important.
Oh, yeah,
I think
absolutely.
I think the results show it too.
Oh, yeah, yeah. How about the students and that type of thing? They say 14 and over.
12.
12? 12 and over?
Yeah, we saw some,
Some?
not many, but some.
Did you go to school?
Usually came with their parents.
Did you go to the school with them or no?
Say again?
Did you go to the school? Because they went to the schools. Did you go there too?
I did not go to the school. No, I only was in that, whatever it is, gymnasium.
Yep, yep.
Hmm. Were they doing it at the school as well?
Hi, sorry, Emily's here.
Oh, hi,
Hi,
Emily.
Hello.
Yeah, they were going to different high schools.
Oh, okay. Okay. Okay, do you have anything to add to?
That's all I know too.
No.
Yeah. I haven't even spoken to Agnieszka.
Uh-huh. Okay, well, I guess we could always go back to it if we have to. Okay, let's move on. We have health agent update. Actually, since the last meeting, there really hasn't been anything that has come up. I think we covered the, actually, there's nothing that's come up,
Yeah.
right? No.
Are we still having food inspections?
Yes.
Okay. I haven't heard anything about that in a
Yeah,
year.
yeah, he's,
Yeah, I mean, last year was, I think he did one time instead of two.
mm,
Yeah, he just does them and then I get they're unannounced.
Well, yeah,
Yeah, so I usually don't know. He does them when he has
but
time.
after he does them, he gives us a report, right?
Yep.
So we should know who he's visited and who he hasn't.
Right. Yeah.
okay, we'll move on to number 3, it's office part-time position. And we have a position here, description, the clerk assists the Board of Health supervisor with the daily operations of the office and other related work as required. So basically, Kristen has been hoping and wishing for someone to help her out because she is a busy girl. I know that quite well. It's a big undertaking when you have people coming in all day long, interrupting her normal kind of business day with so many other things, Title V, it just all goes on and on. But we all have the duties here included, and you can read them over, I guess. I can read them out. Emily, I'll read them out to you. Sure. It says here, the essential function or duties listed below are illustrations of the type of work that is performed. The omission of specific statements of duties do not exclude them from the position if the work is similar, related, or a logical assignment to be positioned. And then it lists all of the different types of duties that that this person could possibly do. First, it says process transfer station permits. Next would be process Uxbridge compost permits. Next would be send and receive summer bathing beach applications, type permits, invoice beaches, and track water test results. Next would be assist public with copies of septic plans and any other correspondence requested. Next would be send all license and permit renewal applications to appropriate parties. Next would be make sure all vendor certificates and insurance are current. Next would be answer phone calls and provide information and refer calls. Then it would be log and file Title V reports. Next would be type approved license and permits, and next would be pick up and sort mail. And finally, it would be cover Board of Health office when supervisor is out. It says supervisor works under the direct supervision of the Board of Health and the Board of Health supervisor to complete assignment tasks according to a prescribed time schedule. Relationship/communications, the Board of Health clerk's duties require the ability to work with the public on behalf of the department. It requires a high level of communication with other departments and the general public.
That's it, another side?
Oh, there is, okay, I didn't know that. Work environment, it says work is performed under typical office conditions with interruptions to response to request for information or service. The employee operates standard office equipment, must be computer
Oh, yeah.
illiterate, it's literate, yeah. So obviously, they must be computer savvy to a certain extent. The employee has regular contact, the employee has regular contact, the
Yeah.
public, it must be with the public, vendors, and other town departments by telephone and in person. Confidential data, has access to confidential information, recommended minimum qualifications, education and experience, high school diploma or 1 year of office experience, or an equivalent combination of education and experience. Physical requirements, minimal physical effort is generally required to perform duties under typical office conditions. The employee is frequently required to stand, walk, sit, speak, hear, and use hands to operate the equipment. Vision requirements include the ability to read documents and use a computer. Through knowledge of office practices and procedures, working knowledge of municipal government, ability to work independently, ability to maintain and organize detailed and extensive records and prepare reports, ability to interact tactfully and appropriately with the general public and town departments, ability to develop an understanding of public health rules and regulations and town bylaws. Must be bonded to handle large amounts of cash money. Work hours, 14 hours per week. And last, it says, this job description must not constitute an employment agreement between the employer and the employee, and is subject to change by the employer as the need of the employer and the requirements of the job change. quite a bit there for a 14-hour position, but I don't, and I'm only guessing, because you can probably help me with this, I feel like it's not that the person has to do all of this.
This is just what,
These are different things that happen in the office that they would be assisting with.
right.
Right, so it may sound like a great deal, but it's more, being an assistant to Kristen.
Have a comment? I'd like to see somewhere in here that English is required, a working knowledge, a something, so that you don't get someone in here with a secondary language of English and struggle.
Yeah, you got to be careful with that, though.
But they can't come in and handle all of the words and documents that they're being asked to with English as a second language, unless they're literate.
Well, I don't think we should advertise it that way.
Okay.
That's just my
I mean, look at
opinion.
Agnieszka.
Yeah,
Right.
I don't think we
And also,
can,
you'll do interviews, right?
Yeah.
yeah.
You can do
But
interviews and,
Agnieszka has a good working knowledge of English.
Right, but not her first language.
No, it isn't. And we
We
couldn't,
could
we
word it
I
couldn't,
don't care whose primary, or what
Yeah.
primary language we're talking about, if you
Yeah.
have a working knowledge of English.
I know what you're saying,
Right.
I understand what you're saying,
I
but
know you do.
But,
Yeah.
but I don't know if we can advertise it that way, and,
I'll say,
it's, I think just as it is, it's okay. The one thing that I noticed, that down below here in the second page, it says, must be bonded to handle large amounts of cash money. Now,
that's the transfer station stickers.
I'm sorry?
The transfer station.
Okay, yeah,
I'm
but-
bonded for it.
Oh, you are bond, how did you do that? Did
It's
you?
just, you fill it, it's like an insurance bond.
Right, but you don't pay for it?
No, no, no.
Oh, okay. That was my concern.
You do it once a year,
Okay,
because if they're counting that much money, they need to be bonded.
right. I just figured that the person would have to purchase a bond for themselves.
No.
Okay, okay.
Is the correct word there bondable as opposed to bonded?
I don't think so.
What do you mean, Dick?
They must be bondable. They must be able to pass the requirements of being bonded.
Oh, they must be, I see what you're saying.
Yeah,
Whatever.
Yeah,
yeah,
The message is clear.
yeah,
that
yeah.
right.
You
Yeah.
can handle Monday and you've got to
Right.
be prepared.
right. I mean, I would think that whoever is handling the bond, what company, what firm is handling the bond would,
I see what you're saying, Al.
yeah.
Yeah.
There must be requirements or whatever.
I can tell you that the few hours that I've been in the office doing a couple of things for Kristen has been
Busy.
chaotic. I have to stand in line while she's waiting on,
Oh, yeah.
Yeah.
and
Oh,
I'm doing
yeah.
work for her and she can't get to me.
I know.
Well, I mean, this sounds like they're doing,
Yeah. She ignores me, too.
Oh, is that in the job description?
Yeah.
a lot of these are like, more like projects, like the
Yeah.
licenses go out once a year, but there's like months of preparation for it. So if someone could just handle like sending the,
You're right.
send out the applications, get them
Right.
back, make sure everything's there,
Yeah.
type them on
yeah,
the typewriter,
Yeah.
things like that. The water, be perfect for somebody. Jennifer's doing it this year for me.
Just, I mean, just to have somebody do that 14 hours worth of work for her would really help her out, probably, be equal to, I was going to say maybe double, but no. I mean, 14 hours, there's only so much you can do, but,
I mean, an extra hand 2 days a week, it's gonna
Well, that
benefit
and
you.
yeah.
it's
yeah.
In the
when
long run.
we're open to the public, which we will be again.
Yeah.
When that door's shut and I'm not there, people they want the door open.
Right.
And I don't always have a senior tax person to cover me. It's
Right.
when they're available,
Yes.
So this will be good.
And
Oh,
at least
yeah.
somebody can work with you and get to know it the way you said. If you do need to take a day out, they'll
Right.
be able to cover you
Yeah.
and,
Yep. No, it's good.
It's good
Everybody feels-
experience as well.
Feels
Yeah.
good about everything else?
I think it looks good and it's much needed.
Yes, I'm
Yeah.
very excited.
That's
So can we
great.
vote on this?
Yeah, we can vote on it. Do we have a motion
And the motion would be what, to
to
accept the...
to accept the
Job
job
description
qualification,
as written?
job description?
The job description, yeah.
Then I would make that motion.
Okay.
I second that.
Second, okay, the motion is passed. Okay.
I do have a question regarding it.
Oh, I forgot. I'm sorry, Emily.
No, it's not, like, I also want the.
Are you behind that screen?
Senior, work it or no?
The what?
That senior tax write-off program,
Yep.
is that too many hours for them?
Yeah, they can only work, I think, 125 a year.
Oh, okay.
What is that?
The senior tax, when the seniors can work to earn money towards their taxes.
Oh,
So they're not
oh,
getting
I see
checked,
what you
they're
mean,
getting- yeah,
like
they're
an
limited.
abatement.
Yeah.
Yeah.
They're limited
Okay.
to how many hours they can work.
Right, right. Okay, you can come out from that screen, Emily. She didn't hear me.
I don't know if she is,
Yeah.
camera's not.
Okay. So we have that. Yeah, looking at the tonnages, next would be number 4, tonnages. And now that Amanda understands it a little better,
Yes.
They're looking good.
they are looking good. And
The
Dick,
cardboard and plastic strips are holding steady.
yes, yes,
All those packages,
yeah.
Amazon,
Right?
yeah. I'm guilty.
Amazon, yeah.
We all are.
Guilty.
Every single day,
Yes.
yeah, they're excellent.
So Dick and company are doing a fine job.
Yeah, they have a good handle on it. And, they rely on Dick to more or less, like, if the second group, I shouldn't say second group, but A group, B group, we'll say Dick's A group, the other's B group. When B group has a question about something, they will contact Dick, and Dick usually has the answer.
Right.
So it's been good. It's been really good up there, and I'm very pleased with that. So, moving on, any questions on the tonnage?
Just, Kristen, do you have email addresses for all of the guys at the transfer station?
No,
All right.
I usually call them. Oh, do you need to email? I don't know if they all have email, to be honest with you.
They may not, but
Yeah.
I will take care of that.
Yeah, I have their phone numbers.
I will get you the list and tell you whether or not they do have one.
My guess is they don't.
And we know that some don't.
Yeah.
You think, yeah, I probably not. Yeah. You're not too far away. You can always run over there.
George has an email.
Or if I can give them things.
George, yeah, you can go
Yeah.
through
If
George.
you need to give them things, I can take it and give it to them when.
Yeah.
They usually come down.
Yeah. Okay. So the next, number 5, we have transfer station discussion compactors. And I know that Dick has been working very diligently on this, which is great. I appreciate it very much, and I'd like to get more involved in that with you, Dick. And we can probably come up with something before. We are extending the original, the past contract. We're extending it for a year, isn't that correct? From June to,
June 30th to July,
okay,
July 1st to June 30th.
okay. And it's going to be as is, except for disposal fee, which will go from $95 per ton to $98 per ton. And I figured it out, the tonnage that we had last year, based on the tonnage that we had last year, approximately $2,000 more is what we're looking at for this year, and that's not that's not unreasonable because of, certainly with the conditions the way they are, and possibility of inflation. I think it's fair enough. So we're going to extend that for another year,
All right,
unless,
What does this letter have to do with what we were talking about? I mean, the dates are.
Well, that's,
yeah.
so he sent me today just what the increase was, but I wanted you to see all the prices, and it just increased $3. This is from last
All
year.
right, so this is old.
This
Yes.
is old, but I increased,
Okay.
the
Yes.
writing on it is increased, it's increased to $98
Right,
for
right.
the upcoming year.
And the hauling is.
And the hauling's the same.
Yeah.
But when he sent me the email at 4 o'clock today, he just put down disposable $98. I'm like, well,
I think we
I'll
should
just
grab
use
this
the old one.
quickly because I'm surprised diesel prices haven't.
We already more or less,
yeah.
we talked to him already, right? We
Right.
pretty much said it's a go. Is he going to write up something for us?
Yeah, so if you all say it's good, then we'll just have him
Yeah.
do the contract.
Okay, so do you want to make a motion here?
To extend it for a year
Yes,
from June,
to extend the BP
July
trucking
1st.
contract.
July 1 through June 30 of
Yeah.
2022.
Yeah.
Okay, so to extend the BP trucking, the waste, okay, solid waste,
yeah.
solid waste to,
Yeah.
one more
Everything
year.
stays the same except for
$3.
disposal, which increases from 95 to 98
Yeah.
per
okay,
ton.
okay, great. And second that motion?
Second that.
Okay, motion is passed, it's been seconded. Okay, so that's transfer station. And what I guess what I want to discuss with Dick and everybody, actually, and Emily, is that we'd like to start now, as early as possible, to try and, look at what you were dealing with over there and trying to lay out a better situation
Yeah.
that would probably reduce cost for disposal. So we want to start on that now before we run into another situation where these months go by so quickly that before you know it, they crawl up on you and it's time to, it's past the time to renew the contract. So we don't want to get into that situation anymore. So when we can get together, I'd be more than happy to help you out with that.
I'm retired,
Yeah, same here.
or is that retired?
Dick also wants to be a part of it, which is, we need him because he's our information.
Yeah.
So we definitely need him.
And George, whenever I'm there, George wants to be an active part of it, too.
Oh, yeah, George is very good at, he understands it well.
He does.
Yeah.
He and Dick work very well together.
Yeah, the A-team is, they do the job. Not to say that the B-team doesn't, because they do. Both teams do well.
They do.
Okay, so anything to add to that, or we'd like to meet at some point, sooner than later, get together and go over some of this,
So when you're ready,
I'm retired, too.
Can't wait to be.
Yeah, I know. You have a little ways to go.
How about, let's see, next Tuesday?
next Tuesday's fine.
Yeah. Probably,
That's the day after Memorial Day.
Right.
yeah, probably in the afternoon, because I have therapy in the morning.
What is the date on that, Kristen?
June 1st.
Is it June 1st?
Great.
And you will set up the time, Bob?
Yeah, probably, like I say, see, I have therapy, how about 1 o'clock?
1 o'clock.
Yep. Is that good for you?
At the transfer station?
Yeah.
Okay.
Is that good for you? Okay, good. And 1. Okay, great. Let's see, that brings us to
Bottles and cans.
bottles and cans, yes.
I was
Well, we-
throwing away some
Go ahead, I'm sorry.
metals, cans.
Uh-huh.
And looking in the recycling bin, I was amazed at the number of recyclable containers that are in there,
Really?
meaning they're going to go to junk.
Yeah.
And so, because I'm active in the senior center, I went to Patrice.
Uh-huh.
And I said, Patrice, would the seniors be interested in doing something to salvage those? And I don't mean crawl in the containers, but do something to salvage the deposits cans.
Yeah.
And bottles are the same way.
Yeah.
And she said, yes, if we, the Board of Health, went to other groups in town, other nonprofits, like Boy Scouts, Girl Scouts, whatever, and offered them something, maybe we could work out that a month, you senior citizens manage it,
To do what?
and the next month, Boy Scouts manage it, and maybe managing it means there's just a big container out there that says, throw your deposits in here, and they go through them and take care of them. So we have nothing to do
Yeah.
except let them do it.
I don't know if that's going to create a problem. We've tried doing things like that in the past. We've run into, situations where people will complain about different things. Maybe not, but I can recall,
I know every time it was brought up with the Boy Scouts and stuff, they
yeah,
shut it down, but I don't know.
yeah.
So you tried it with the Boy Scouts?
I wasn't here when you tried it. I
Yeah.
just know ever since I've been here, they've asked to do stuff like that, but I think it was
Yeah.
more that it was a
I think
safety
somebody
issue.
was, cashing them in for themselves, you know what I mean? So, yeah.
Would we be willing to do this? Would you be willing to
I-
let me go talk with them? and come
Oh,
back to
yes.
hear
Oh,
with
yeah.
a
Yeah.
specific
If we can
proposal?
come up with a good plan that works, that, like you say, put a container there or whatever, and,
Put a
yeah.
sign on it or something.
Yeah.
Yeah,
nonprofit, because that's, people think, oh, they're getting this cash, what are they doing with the cash?
yeah,
That's the problem we had,
all right. All
so,
right, that's good input. But
Yeah,
let me
yeah.
go off and talk with the various groups and come back to here
Mm-hmm.
next time with a proposal.
And two, like, when are they going to come pick it up? Like
When are they going to
when
what?
would they come and go, I think for safety issues too? Like the Boy Scouts?
oh, yeah,
To be down there, like picking, like, we'd have to think of a way
Right,
for them to safely do
right.
that.
yeah, I don't know how that's going to work, and I don't know if it would,
Well, let me just explore. it.
sure,
Yeah.
sure,
Back.
that's
Yeah.
fine, that's fine.
And we'll make
No
no
They'd have to
commitments.
put it down by the tin, probably.
So are you saying leave something out for the Boy Scouts and people drop off cans and bottles and then they bring it to the
That's a
transfer?
potential. And I
Okay.
haven't
Yeah.
discussed it with anybody.
Right.
Except this group and Patrice, so I don't have any specifics in mind.
It's a great idea.
Yeah, it is a good idea,
I mean,
I have
save
no,
money
Yeah.
somewhere that could use it, yeah, but I see what you mean.
absolutely, I mean,
Who's
if,
gonna bring it and drop it?
Yeah, they're going to be
Yeah.
like
yeah.
so busy, it's.
The only
I think
thing
there's
that-
Not one busy spot down.
The only problem I have is with traffic.
Yeah.
I mean, it's another stop, it's another, and it's a confined area up there. It's not,
Unless they picked it up on a
And
Tuesday.
Saturdays are chaos.
yeah, Saturday
Yeah,
is
some days-
chaos.
Times of days that aren't any better. I mean,
Right.
cars are going everywhere.
Right, holidays are issues, things like
Cars
that.
waiting to back in and,
Yeah,
yeah.
yeah. That's my issue, is that, but,
All right, safety's on my list.
okay, okay. We all set with that?
Yes, thank you.
Okay, sure. Okay, so now we move on to old business. So, anything for old business?
I have new business.
Okay, new business is
Well,
good.
Like we were talking about, the Monitor Wells got passed.
Oh, yes,
So,
yes, yes.
I don't know. So Bruce had already given us a quote, and we put the money in for the new budget, and it was approved.
Yeah, that's
So
good.
that's really good.
Yeah, it's I think it's a fair price for what he's going to produce for us, so.
Yeah.
Now, do we have to make a motion for that?
Maybe we should, I don't,
It won't hurt, right?
Are you saying that the town meeting has already approved funding for this,
budget.
for the purpose of monitoring our monitoring process?
Yes.
Yes,
Okay.
Yeah, we've increased the budget for that,
yeah.
Right.
yeah.
But he's doing,
Multiple, yeah.
Multiples,
he's
yeah.
Handling the whole thing, like
Right.
reading the
Yeah.
report, sending whatever he needs to send to the state. If there's something
Yeah.
wrong, he's going to take care of it or let us know.
right.
And it's already approved, budget's already.
His
So-
budget's approved,
And
yeah.
so it would seem like we don't have anything to do if a higher level of authority has already approved it.
Yeah, probably. That's why, yeah, maybe we don't have to make any
He's
kind
like
of motion.
like a contractor, so I don't know.
Yeah.
Yeah.
Yeah, it's already
Yeah.
been,
And
Right.
the town meeting specifically approved him as the contractor? Or did
No,
they do it
they
in a
approved-
generic sense?
The generic sense.
A person?
They increased the amount, that's it.
Okay, then we do have a motion.
yeah,
to
we
make.
do have to, yeah, yeah.
Have we gone out to bids on this? Or how are we handling it so we don't have to?
We don't have to.
No. They said that, the upper echelon said we don't have to.
Okay, so if you give me the name, I'll make the motion.
What's
Bruce
his-
Langdon,
Bruce
Langdon.
Langman. All right, I move that we hire Bruce.
No, Bruce Haskell.
Haskell, yeah.
Langdon is.
Bruce, whatever his name is.
Yeah.
Langdon is the company, environmental.
All right.
Bruce
Yeah,
Haskell.
okay.
So I move that we hire Bruce Haskell to monitor our well monitoring process as previously approved financially by town meeting.
I
Right.
second
To
that.
approve the budget, approve in our budget,
Yeah.
right? And you second it?
Yes.
Okay, the motion has been seconded, and it is passed.
Is Emily still with us?
Emily, you still there?
Yes.
Oh, okay. Can you hear us okay?
Yeah, I can hear you.
Okay, okay. Do you have anything to add?
I don't think so.
No? Okay. All right. We just, yeah, I just didn't want to bore you to death there. Okay. Any other new business or old business or anything else? I wish that we did have Agnieszka here, but she must have been tied up.
Yeah, she actually said she had emailed me earlier. I
Oh.
didn't get.
Oh, okay.
I see Corey isn't here,
No, Corey isn't here.
but I was wondering if he ever was able to talk to the baseball league about how I said there was no mask or social distancing going on at the baseball games.
Here I am.
I'm not, he didn't mention anything to me.
Saturday.
Yeah.
Okay.
What town was it, Douglas?
Douglas, yeah.
Okay, so,
I could just see everybody against us times when I drove by.
Yeah.
So when has the governor taken off our masks? When,
Saturday, I think it is.
the one Saturday coming up,
Yes,
before Memorial Day? Okay.
right? The Saturday before
Yeah, that's
Memorial
right.
Day. Yeah.
As long as you're vaccinated.
And if there's stores that still say mask required, you still have to abide by that, so.
okay, so we have nothing else?
You know, it's amazing how effective the masks have been. Influenza is,
Yeah, I know, yeah, yeah, yeah.
so they're
Yeah.
saying, maybe we should do something like this every year.
I don't think so.
No, I don't mean the COVID, I mean the...
I know what you mean, but no. No, I've had the flu before. I'll take the flu before this.
I had COVID, so.
Did you?
Yes, in
Oh.
March.
Oh, how did you do?
I was okay.
You're okay?
Yeah.
You had symptoms?
Yes, I did.
You did?
But I wasn't as bad as some people that I
Right,
know that have got it.
right.
Just, tired and a cough.
Okay.
headache, so,
Almost like a cold.
yes.
Yeah.
Yep, I did lose my taste and smell, but I got it back. Actually, my fiance lost his, and his is still,
Wow.
Really?
yeah, his is still off.
Wow.
So he's like, I feel like I'm learning how to taste again.
Yeah, but that can happen with the flu.
Yeah,
As
yeah,
well,
and
because it
even-
happened to me with the flu,
Yeah.
where
So-
I lost my sense of taste.
Maybe it was COVID.
I'm sorry?
Maybe it was COVID.
No, this was a while ago. I did have the flu, I tested for the flu, but no.
Remember you were sick, Wade?
I was.
Remember way at the beginning?
I probably had it.
Before March. It
Yes.
was like February, January of that
Yes, thank
first-
God for
first
Krista.
year.
She remembers everything
Yes.
for
Well,
me.
you were really sick.
I was.
Yeah.
Yeah, it
I
was,
bet you. You might have had it even.
I
it definitely
probably
wasn't
did.
fun, but
Yeah.
it
Yeah.
was,
Wow, I didn't know that. I didn't know that.
yeah. I
Did you
mean,
guys know that I had it?
Agnieszka had
No,
it.
you too?
I mean, Agnieszka knew I had it. She called me up.
Oh, my.
I live in Douglas, so.
Yeah, yeah.
She's like, I hate to call you. I'm like, I know.
Emily, you had it too?
Yeah.
And you have recovered?
Did I recover, you said?
Well,
You
did you recover? Obviously, she did.
Well, I mean,
Were your symptoms bad?
I felt like I had like allergies, like it was all like
Oh.
very congested feeling,
Yeah.
and almost like I was getting like an ear infection. Like I felt like
Huh.
that, but like from allergies. You know what I mean? Like just so much fluid.
Yes. Yeah, I mean,
So-
some people I spoke with, they could, barely move. I could still get on with my day,
Right.
but it was, definitely knew something was off.
Yeah,
So,
yeah, yeah.
and my
Yeah, I
son,
was really tired too.
my son ended up catching it too.
Oh, we did.
Oh, my.
And it was weird because I had it, then a whole week later, he started showing symptoms. And
Gee.
I'm like, uh-oh. I was just out of my quarantine, about to go to work the next day. And then I took him, and I'm glad I did because they're like, yep, he has it. So I had to quarantine all over again.
Wow.
Luckily, it was during my quarantine, so he wasn't in contact.
And he was okay?
He was okay, but he did have a runny nose, like she said, allergies.
Yeah.
The first
God,
2
that's
days,
sad.
he was very cranky, irritable, but after that, it was just like an allergy, a common cold.
Hmm.
So,
Scary.
Yeah, it definitely is.
Yeah, it can be. I guess, it's,
The weird thing for me is my boyfriend didn't get it.
Really?
Yeah, so my fiance tested negative,
oh,
but still had a quarantine.
sure.
And then when
Come in contact.
when my son got it, then he had finally
Yeah,
got it.
yeah. Wow.
And I was in contact with my mom when I didn't know I had it. I got the phone call, somebody I was in contact with had it. My mom never got it.
Oh, good.
So
Wow, that's good.
I was thankful because that's a whole nother household.
Yeah, yeah.
Oh, my
So,
God, yeah.
But they still quarantined and stuff too, because,
They were contact.
yes.
Wow.
Yep, spread like wildfire, so.
You were only, you were my neighbor right down the street. You were pretty close to
Yeah,
me.
I know.
Wow. That's scary. Okay, so do we have anything else?
Actually, I'm just wondering, maybe I missed it.
Yeah?
But how is the COVID clinics? Is it still
Oh,
going
yeah.
or?
Yeah, Dick?
Dick probably knows more than I do at this point.
Dick
'cause I've been out of the
can
loop.
probably answer to that.
no,
I think
No?
it's very slow.
Very slow, right?
clinic is slow,
Yeah.
but
I mean, they're still doing it. Just,
maybe. They were going to shut down because of an election at one time. When I went in Tuesday, they'd set up only half the space for people who have had vaccinations. And there was nobody in there to begin with, but it was
Yeah.
still half the space. And at one time, they were doing like 40 or 45 people active
Yeah,
after the
Right.
vaccination. I mean, it was like mob scene in there.
yeah, yeah.
And,
Have you been vaccinated, Amanda?
I haven't yet because of, I had COVID.
Oh,
So when I was gonna get on the schedule, I ended up having that, so I have to reschedule.
oh.
I was waiting for everything to
Oh,
calm
I
down.
see, I see.
how long do you have to wait?
I don't know, so, one of my coworkers got the first shot, because he had gotten it too, and then he had to wait to get the second shot, but I don't know if he has to start over. I don't know how that works, but I think he's eligible this next week. So that's amount of time. So I'm guessing that he said he could get his next week. So I'm guessing I can do it again.
Wow. How about you, Emily? Have you been vaccinated?
Yeah, I have.
You have?
Yes, I got Moderna, got both doses.
Huh.
I will say, Amanda, I felt kind of crappy after the first dose, which a lot of people who had COVID reported, but the second dose was mostly fine.
Yeah.
Yeah, a few people at my work that had gotten it before did feel a little off the second shot.
See, I didn't feel anything.
Really?
Yeah.
Some people didn't, but one of my friends did get the Johnson & Johnson, and for like 2 days,
Oh,
she
really?
felt like she had
Agnieszka too.
COVID.
Yeah.
Yeah,
Yeah, she was really sick.
yeah, because I was like, even when I had it, she couldn't even move.
Yeah, she was the same way.
Yeah, so,
You never know. Maybe they just gave me sugar and water.
everybody's body probably reacts.
I know.
So.
You really don't know.
And then they say if you did have COVID, you're already immune to it, so it's just
Right. Well,
every,
like Kristen said, I probably had it.
yeah.
I wouldn't be surprised.
I know. I
A lot
was
of
pretty
people
sick.
say
Yeah.
that
I
too.
was pretty sick,
A
yeah.
lot of people
We were
got
all
sick
with you
around
at
that
that time.
time.
Yeah, my,
probably all have it.
my lungs were, yeah. You're probably right.
That was before we even really knew about it.
I know.
Mm-hmm.
Well, it was just about, yeah, right, you're right, because it was
before.
February.
We had no, because we wouldn't have let you come in the office. Yeah, it was before.
Yeah, yeah. Okay, folks,
We have a next meeting date?
yeah, next meeting date,
Book that.
you always remember that.
Well, I was about to make a motion to adjourn, and I knew you were going to say, well, we need a meeting date. So I said, oh,
Save the,
No, that's okay, that's good, because you don't know that I would have remembered.
the little lady sitting over there would have.
Yeah, yeah,
Yeah.
you would have, yeah.
Do you want to do the last Monday of June?
yeah,
Uh,
that
How
works for
close is
me.
that to July 4th weekend?
July 4th would be the following Monday we'd have off. So it'd be a
Do we-
week, because it's
how about-
it's on the
So
following
This is
Sunday,
a week ahead of time.
right?
Okay.
How about, do we have to have a meeting?
If we don't have anything.
Well, that's what I'm saying.
Yeah.
If we don't have anything, maybe we can schedule it if something comes up.
I know that maybe we might have a variance coming up, but I don't know yet.
Okay,
So if we do,
yeah. We could have a quick
We could
meeting.
have it one-
But that's what I say,
Yeah.
we can schedule it, but not necessarily, you know,
So let's have an open date.
June, which
Right.
one was it?
I lost it, hold on. 20, the
Are we ready
last,
for a motion to adjourn?
I'm ready for a
28th would be the
motion to
last
adjourn,
Monday.
yes.
Okay, so, and is it,
tentatively, June 28th.
is it gonna be hybrid or in person? We don't know yet.
We'll say hybrid.
Okay. Just I
I don't know, yeah.
Yeah.
need to make sure my fiance's out in time for me to get him. If I can't, I'll pop
Oh.
on Zoom.
If anything, it'll probably be here or hybrid.
Okay.
Yeah.
So you have no date, you just,
6/28.
oh, you're really
June 20th.
scheduling
The
a date?
recording has stopped.
Okay,
6/28 tentatively.
He's probably like,
We
"I'm
might
sick of
have a
them just
variance
talking."
come up before that, I'm not sure.
Okay.
yeah. Well, if we do, you know,
Yeah.
we have the meeting,
Okay.
that's fine. Okay, so we have a motion to adjourn?
You do.
Okay, second?
I second that.
Okay, the motion has been passed.
Sneeze.
The meeting is adjourned.